Indeed, that's what we're talking about now. What's going to happen now that we have the vaccines here and distribution has started? What next? What do we need to do to achieve herd immunity? And what are some of the questions that we need to answer from our population on those vaccines? We have with us this morning Akela Ishaku, who is a virologist and a public health epidemiologist. We have to thank you for coming on Sunrise Daily this morning.
Thank you, Mayokwe, for having me.
Well, you have seen the arrival of the vaccines. I'm sure you've watched the progress so far. We saw the first health practitioners receive their shots of the vaccine. And then on Saturday, we saw the president and the vice president. And then yesterday, we saw members of the PTF receive shots of the vaccine as well. And we saw the first state in Nigeria receive its own batch of the vaccines. I think it was Ogun State that received 50,000 doses of the vaccine. But what are your thoughts now? Because people who are thinking, we've been told that health workers will prioritize. They're first on the list, then elderly people, and then people with comorbidities. Are we on the right track with what we ought to be doing now that the vaccine is here with us?
I think I want to commend the Presidential Task Force and National Primary Health Care for drawing that timeline and the strategy being involved in this immunization, exercise. I think we are on the right track because we are leading the talk. I think I want to commend the President for the Vice President and other members of the Presidential Task Force for leading the talk and then get vaccinated, openly. And then I've listened to a lot of podcasts being sent via WhatsApp and other social media platforms. I think we're on the right track. It's just that there are a lot of gaps that we need to close. So we need a robust, sustained stakeholders engagement, stakeholders continuous communication, and then collaboration. This is quite key. So when I talk about leading the talk beyond the president and members of Presidential Task Force, publicly being vaccinated, we also need state governors, we also need religious leaders, faith-based organization leaders to actually lead this talk. Maokwe, come to think of it that if we have the Sultan of Sokoto taking these shots with some sheikhs from the north, that will go a long way. Once we have Reverend Father Maitu Kuka and Oyenaikon, I think, like that. What if we have senators, members of House of Assembly, we have traditional rulers taking these things? So they need to lead the talk. It's about keeping the well-being of a nation. And it is this time that we need a national cohesion. We need people to actually lead this, irrespective of our religious lines, irrespective of even our political party differences. So we expect people to lead this talk. And I think this is what I am expecting as an individual in the coming days. Come to think of it, that a vice chancellor of a university takes the vaccine and, all what have you. Come to think that the CMDs of tertiary healthcare institutions, teaching hospitals, and because we prioritize giving specifically to health workers, CMDs of federal medical centers taking this. So I think we need a lead to talk. We need to lead the talk in this campaign, and I think it's quite key in this direction.
You have emphasized the role that leadership needs to play at every level. The fact that, yes, the president and his vice president have led the way, and we're seeing, other members of Nigeria's leadership, so to speak, leading the way. And you're saying that a lot more on different layers of society need to do that. But there's also the question of saying, yes, much as the need to show leadership, how do we also ensure that this doesn't become an elitist thing in such a way that, the leaders are getting it first before maybe the people that truly and would honestly need it. What are your thoughts in terms of balancing the act?
So I agree with you that we need to balance the act. So those are the things that I think there are gaps. I made mention earlier that I, as a person, have seen some gaps, and then these gaps needs to get closed. So we need to also balance. So I agree with you that it should not be like something that has to do with the elites, but we can also see to how common people within the society can actually take these vaccines. Come to think of it, if we have, you know, market women in markets taking the vaccines, come to think that we have 1 or 2 almajiris on the street, you know, through their malams and then through robust advocacy.
But they don't qualify just yet. I mean,
yeah,
they're usually quite young.
Yeah, there are almajiris that are above 18 years. Yeah, they are still above 18 years. So it's not about the small children you see on the street. There are actually almajiris that are even 20, 21, 22, 23 years and above. So we can see to how we can also, you know, engage people like the road transport workers, their unions, we can passengers, you know, boarding at several parks. So those are the strategies that we need to deploy so that it doesn't look like I did a survey, an online survey, to find out the buy-in of these vaccines, even among health workers and among general population. A lot of people are still hesitant of this. So we need to break the ranks. You know, among the health workers, it's not about them doubting the science, but it is about the distrust between them and government. A lot of them says that, you know, you did not give us palliative. You did not give us you know, hazard allowance. It is vaccines that you want to give us. So actually there is a kind of a disconnect, a distrust. And those are the things that we need to actually work on in terms of rebuilding our national values and reorientation as a country. We need to actually dig deeper. It's not all about COVID-19 vaccines. It's holistically about all facets of our lives as a people and as a nation. So I think the Ministry of Communication and Information needs to do a lot. Private, you know, companies, private, they should go into public-private partnership. I expect that by now, you know, engage in a robust private partnership with organizations like China's TV to drive this process. So I think it is quite key. It's not all about vaccine. There is a major distrust between the Nigerian citizenship and then actually the leadership of this country.
That's a lot of work definitely needs to be done in that particular area. You know, I'd like to know a bit more about the survey which you conducted amongst the health practitioners and their, you know, hesitancy for the vaccine. I'm just wondering, you know, apart from distrust, what more could be informing it? But, you know, maybe you shed a bit more light on that. I'm wondering, 4 million, just roughly about, I think, 3.9 million doses or so was what arrived in Nigeria. We're expecting a total of 16 million, so to speak. But we know that that will not go around the entire population. And we also know that this particular brand of vaccines that we have, you need to take 2 shots of it. Do you think that we will be on course? If we have to name one of these people that we need to give vaccines within a period, would you think I will have enough, you know, to be able to give a second dose on time so that what we have on the ground right now will be effective? It will not be a waste. What are your thoughts on that? Yeah,
I think we don't have enough vaccines. Ogun State just took stock of 50,000. And you know, the population of Ogun State is way beyond 2 million, I think 2-point-something million. Then a country of more than 200 million having just 4 million vaccines. I think the vaccines are not enough. For us to achieve herd immunity based on the public health model, you need to cover 70% of your population. So the vaccines are not enough. If you take the percentage of 44 million to 200 million people, you discover that the percentage is quite insignificant. And I think that time has come that the COVID need to play a critical role in this. We need the likes of Dangote, likes of Boa, likes of Nestle, likes of Coca-Cola. This multinational company needs to come. They are not only here for profits. You need people to be alive to buy your products. So I think time has come for them to actually buying into this and support the process. Other countries like South Africa, most of their multinational companies have actually placed a queue in terms of getting these vaccines, because vaccines development and delivery is not something that you place order today and you get it next week or in 2 weeks' time. So I was thinking that by now we would have a future plan, what 6 months, maybe a medium-term plan, what 6 months, what 1 year will look like. By now, we should, at our fingertips, say that in 6 months, we need to get hold of a delivery of a vaccine.
Do you want to state specifically where you want to see COVID? Because you understand that even for this 4 million, they will be helping with logistics, with the transport logistics to get it to different states.
Absolutely. But it will be quite key that we actually also involve the private sector. I was thinking that...
in what specifically? Is it in getting a hold or in research and development or what?
Absolutely. Also in research and development, also in terms of transportation, even in terms of logistics. Let government create an enabling environment for private sector to actually drive. Government, COVID doesn't, to me, should have a minimal role even in terms of transportation and logistics. We have great companies in Nigeria that can be able to do that. I was thinking that the COVID should have a focus on even how they can support the nation in terms of vaccine supplies and deliveries. Those are my thoughts and my shared sentiments and my naive thoughts. So also, private sector needs to come into research and development. People may not be able to, not all people need the second dose. Technically, people that are positive for COVID and they recover, they may not necessarily need the second dose. A dose is okay to just boost their immune system. I think we need to also do a lot. Since this is a rollout program, what I expected for us to do is to place a mechanism through which we can actually see to how many people actually develop immune response to this. So there is no that window. In other spheres of life, once you give a vaccine that is new like this, you roll out, it would have also created an opportunity for us to raise scientific epidemiological data to actually improve on the vaccines. So you give somebody a dose like a baseline. So first of all, you also need to also screen people to make sure that they are negative before they take it. But you know, for vaccines, you have to do the cost-benefit analysis. The vaccines are cheaper than even the test. So, but once you give somebody a vaccine, you need to actually take his sample to check whether his body has actually mounted immune response. After the second dose, you still need to check. So those are pathways that you can also check for vaccine efficacy. And I think that that has not actually been put in place. So we need private sector to come in terms of research and development, which is quite key.
Let's take this to Lagos, and I'm sure my colleagues will have more questions on that. Gentlemen.
Well, yeah, we actually do have Dr. Tijani Hussaini, who is the technical coordinator of COVID-19 response in Kano. That's where he's joining us from our studios in Kano. Good morning, and thank you for joining us today. Well, there have been previous headlines about Kano, or I beg your pardon, some states not being ready to receive the vaccine. And I think at some point Kano came into the picture. Could you give us a proper picture? What is the situation now? Is Kano ready to receive these vaccines?
Good morning, Chamberlain, and thank you for having me in your program. Yes, Kano is ready, is getting ready to receive the vaccine. We were informed by the National Primary Healthcare Development Agency that Kano would receive its own consignment of COVID-19 vaccine today. We were expected to have it yesterday, but we are going to receive it God's willing today. And if you look at our overall preparation now to begin the rollout, we will say we are around 70% ready. And within the next 1 week, Kano would be ready to begin the vaccination across Kano. And again, we have, over this period of time, prepared about 509 facilities, primary facilities, secondary facilities, tertiary facilities, to be sites where vaccination is going to take place. And why it is easy for us to begin this rollout successfully is because of the investment made in immunization services in Kano. Over this period of time, the immunization space in Kano had developed so much that we do last mile delivery of vaccines, and we are using that same backbone to ensure that COVID vaccine reaches the intended target.
So what is the rationale behind having 509? How are you going to deploy it? Who are those to come up first for receiving it?
Yes, the strategy actually was to have at least a primary health care, a facility in each of the 484 wards of Kano, and again, have additional secondary facilities and tertiary facilities where this vaccination is going to happen. Remember, COVID vaccine is unlike polio, where anybody can give polio vaccine in as much as he can drop the two drops of polio. However, for COVID, you require health personnel and you require certain infrastructure for us to deliver. And if we look at the space, Kano space, we require as many facilities as we can. And because there are strategic equipment needed, that's why we need to. That's why we need to have these 509 facilities, and this is the rationale for choosing these facilities. And as per the national plan, we intend to start with the frontline health workers over this period of time between now and March and April. We are going to target frontline health workers, the people at the point of entry, uniform personnel, and those who are intimately involved in the COVID-19 response, so that we protect them to ensure that they don't get COVID vaccine, COVID infection.
Right, so in terms of, the amount now, we understand Ogun State got 50,000, so I'm imagining maybe Kano might be getting more. Do you have an idea just how many vaccines Kano State is getting today?
Yes, Kano, we are expected to have at least 1% of our population, and so we are expecting around 160,000 doses of COVID vaccine. However, this is only the beginning. The whole vaccination is going to be in 4 phases, phase 1 to phase 4, and it is going to be over a period of 18 months to 2 years. Between now and 2022, we are expected to, in the whole country, to vaccinate about 70% of the population, and that's around 150 million people. And in 2021, the whole country is expected to vaccinate around 85 million people, while the remaining 65 million people will be in 2022. So in Kano, if you do the computation, we are expected to vaccinate about 10 million people, and in 2021, about 8-9 million people.
Now, earlier on when we asked about the rollout plan, you said you're about 70% ready and that vaccination proper will begin in a week. I believe I got you right then. But, this is something we have anticipated for weeks, months. We kept thinking, okay, we should get the vaccine. So the thinking for me would be, hit the ground running, as they always say. So what challenges are you facing really? How hard is it to reach 100%? And why do you have to wait a week before you start the vaccination process itself?
The COVID vaccine itself is a new vaccine, and if you look at the resources required, that is huge. Although Nigeria is also keen into other vaccine facilities, such as COVAX and also the Africa Union funding mechanism, but the resources required is huge. That really the country would require a lot of resources. That might have contributed to us only vaccinating 70%. And remember from the last guest, for us to reach herd immunity, we require to vaccinate around 70% of the population. And that is aside the logistic issues, distributing this vaccine to each and every corner of the country, as well as the social mobilization that needs to happen. So these are some of the issues that we are considering and ensure that we've reached the right targets.
One of the things that comes to me, I mean, you talked about huge resources that will be required to take on the task of vaccinating people in Kano. Well, I'm just wondering, you said you have more than 500 vaccination points in Kano State at the moment. I'm wondering how huge is the resources that will be required? What's the budget line like? Because, I mean, I'm just imagining that you need at least 3 persons per vaccination point at the very least. So I'm wondering what's the quantum of resource that Kano is likely to be deploying to get this done?
So actually, in each of the vaccination posts, we require 5 people. So if you do the math, you are talking in thousands of people to be deployed. So the resources required are actually huge. At the moment, we are thinking of hundreds of millions of naira because you need to pay for the transportation of the vaccine itself, payment of personnel, incentive, resources for community mobilization, and so many other things. So at the moment, we are getting the figures of how much we are going to require to do this vaccination. However, it is going to be in hundreds of billions of naira.
Hundreds of millions of naira, maybe like 200-300 million?
Around that range.
Okay. Now, we have talked about the purpose or the functions that government has to perform. But then there's the assignment of getting the people ready. Government is getting ready. How are the people being prepared? Because you know there is a high level of vaccine hesitancy. If we could have hesitancy on the part of people who were to take the polio vaccine at the time, which was so easy to receive, how much more now that it's a lot more complex? On the one hand, people don't like taking vaccines, taking injections generally. On the other hand, there are those who just have a phobia for needles. So how are people being prepared to take this on?
We are embarking on so many social mobilization activities. People get relaxed. The vaccine hesitancy reduces when you engage people the more. When you tell them, when they understand what the issues are, what the benefits of this vaccination is, and what other benefits they can draw out of it. And we are currently engaging several key stakeholders to ensure that this message, the benefits, the usefulness of this vaccine is clear to them. And I think we are making progress. Yesterday, His Excellency, the Executive Governor of Kano State himself, had to engage security agencies who are also amongst the first people to get this vaccine. We had to engage professional associations, health-related professional associations, which also they gave us their full support. Now we are currently engaging traditional institutions, religious leaders, all key stakeholders to ensure that the message is passed, the message is received, the message is understood. It is only when we do that, and we are currently on that, that we are going to be successful. And from what we've seen, and also from the little researches we've made, the vaccine hesitancy in Kano is not as high as is imagined. There is a lot acceptability on this COVID vaccine. And remember, we had polio experience. We are going to apply same learning that we had in polio to ensure that we reduce vaccine hesitancy in Kano.
All right, we'll take it from that point when we return in just a moment. Do stay with us. Welcome back. Let's get back to Dr. Hussaini. Talking about vaccine hesitancy. Well, you do know that you spoke about the polio vaccine experience, but that experience too, in 2013, thereabout, you remember that there were some gunmen who had shot some of those vaccinators and then attacked another health facility at that time because they believed that the polio vaccine was going to make people infertile, and so that happened at the time. And then, you know, there was some equal hesitancy in several other parts of the country. So does that then suggest, or are you telling us categorically now that all of those experiences are history, there will be no such thing right now with this COVID vaccination?
Yes, unfortunately, sometimes, just like you rightly mentioned, in 2013, some of our workers were attacked. And because of this kind of unfortunate situation, the Kano state government is liaising with all the security agencies to ensure that we provide the necessary personnel with the necessary security cover to ensure that they are not attacked. There is no such similar incidents. However, the best approach of ensuring security is systematic engagement with people so that the people can protect the vaccines. This is what we are doing currently, ensuring that the people that are going to be vaccinated, they take custody of the vaccine themselves. They ensure they provide adequate security to the vaccine in addition to the formal security architecture. And with that, we feel the vaccines, the health workers are secured enough, and there will not be any repeat of such ugly incidents.
Right. So I'd just like to understand, you know, the workings of this. So we have the MPHCDA, who's primarily responsible for the whole vaccination process. And we have states coming in. I mean, the president did say that, you know, states need to increasingly show responsibility, as it were. So in terms of working together, who is meant to do what? The state and the MPHCDA, such that we don't have clashes and all that. So just how are you managing that?
Can you repeat that?
If you can hear me, I'm trying to understand the workings between the state and the MPHCDA, because over time we've heard states say, well, we're going to try to purchase vaccines ourselves, ensure that we protect our people in line or in addition to what the MPHCDA is providing. So for Kano State, how is that working going to work, as it were? How would you ensure that the person responsible for this does this strictly and no lines, no toes are stepped on?
The line is a bit very unclear, so...
Ironically, I said the line, but we'll try to get back to you on that. But let me try this one more time. If you can hear me, Dr. Hussaini, let me just ask, can you hear me?
Yes, I can hear you.
Oh, thank God. So the question is, how will the workings be between the state and the MPHCDA? Let me just keep it short.
Yes, the state is working with MPHCDA to ensure that we've successfully rolled out the COVID vaccine in Kano. And remember, the vaccine itself is coming from MPHCDA. So we are keen into the national strategy, national activities, and national program. So we are working hand in gloves with them to ensure that we deliver these vaccines in Kano successfully.
So essentially, MPHCDA is taking the lead here and not the state?
Yes.
Okay. Speaking of strategic...
Currently, there are officers in Kano from MPHCDA that are supporting Kano to ensure successful rollout.
Okay, so in terms of who will get the vaccination, it will be decided by the MPHCDA and not the state, right? In terms of who will get the vaccine, in terms of who will get the vaccines, that will be decided by the MPHCDA and not the states. Am I right?
Yes, the source of the vaccine is from the national government.
No, the recipients.
So we are getting...
I mean the recipients,
yes.
Not the source. The recipients of the vaccines. Will that be determined by the MPHCDA or the state?
I didn't get that.
Okay, Dr. Hosseini, I'm asking who will decide who gets the vaccines. Is it the NPHCDA or the Kano State government?
If I get you right, you are saying who gets the vaccine?
Yes.
Who decide who gets the vaccine?
Yes, the recipients, yes.
Yes. The recipients of the vaccines is actually as outlined by MPHCDA, so we are following the guidance from MPHCDA.
On a final note, before we toss this back to Abuja, in terms of strategic leadership, will we be seeing Governor Ganduje get the vaccine in public and other government officials?
Can you repeat that again?
You know what? We'll work on the connection. Let's just go over to Abuja, where Dr. Shako is with us, while we try to get this connection clear. Well, Dr. Shako, there have been a series of questions as to what happens now that people are receiving the vaccine. This is meant to be phase 4, but I mean, people are referring to the fact that this phase 1, 2, 3 happened pretty fast. So what should we be looking out for, really? Those who have taken the vaccines, what's maybe, I don't know, is it NAFDAC, is it NIPRID? Who should be doing what right now that people are getting those vaccines?
Actually, as in the first phase 1, as people tend to get the vaccine, the NAFDAC supposed to do like a follow-up studies actually into a research to actually look at adverse effects and adverse reaction as a result of this vaccine administration. And I hope in my thinking that that should be activated by now. We should have committees in states, adverse reaction committees in states that should be able to monitor this vaccine administration and also report back to the national so that we can have a data on NIPRID is supposed to also conduct a lot of research. Even NIMA in Lagos is supposed to do what we call vaccine post-vaccination efficacy studies to actually check whether our genetic makeup as black race from Africa, whether we have mounted a lot of immunity towards this. There is an aspect too that we don't discuss about that, and I think it is quite key. We need to talk about vaccine injury compensation. This is what is being discussed in the UK, in the US, and other advanced nations. What happens to people that get injured at the cost of this exercise? Do we have some sort of insurance cover for them? Are we thinking in that direction? What is the narrative about vaccine injury compensation? Those are aspects that we need to look into.
What do you mean by injury?
Yeah, so there are people that develop a lot of adverse reaction as a result of vaccines. We saw that in the meningococcal vaccines in Kano, where people develop a sort of deformity, sort of associated adverse reaction and adverse effect as a result of the vaccine intake. So, Maokwe, what happens? Do we have a compensation plan for them?
We understand that a lot of the vaccine companies are seeking, indemnity. They do not want a situation whereby they will be sued, assuming anything should go wrong. Because let's not forget that these are emergency shots.
Absolutely. So that does not stop us from also having our local arrangement, trying to get insurance company to come in. Private insurance company to come in to actually, so we don't also have these things in-house. So my thinking is that not a copy and paste approach, we should be able to have a sort of a compensation plan, even nationally, state-wise, and local government-wise, so that we can be able to see how we can compensate individuals that may have adverse reaction and adverse effect.
And this will be without prejudice to the companies that created the vaccines.
Absolutely, absolutely.
Mm. Just wondering though, when you look at, hesitancy, and you look at the fact that you're also bringing up this sort of, arrangement, do you think it's going to make people more hesitant?
No, I think it's going to create more confidence in people because those are the indices that measure safety. If you tell somebody that I give you a shot, in fact, we should also be able to tell people that you will develop some sort of high fever because we have different immunological response. There are people that take vaccines immediately, they start sweating, you know, the place gets swollen up, they develop fever over time, some even go into vomiting. Those are kind of health education that we should be, most especially among the healthcare workers, we should be educating them. And so when you tell me that no vaccine in life is perfect in terms of production, even in terms of immunogenicity. So we should create a window that if things did not go the way it should be, what happens? That also tends to build in confidence and the buying in. So because if you tell people that there is a compensation plan, should in case anything happens, which is done in other places, I think confidence will be built. That's just my shared sentiment.
You don't think that dishonesty could creep in as well?
And not at all. We can move around that and walk around that and to see to that. Yeah, I think if NAFDAC will actually also share with the Nigerian population certain results, data they have, or even part of their trial, they should be able to tell us that for every vaccines that you administer, there are some levels of adverse effect and adverse reaction that you get.
Yeah, but not for every vaccine. I mean, we know that from children, the vaccination rounds we do for children, there's some of them that have adverse reactions. There's some that will tell you, oh, don't bathe the child in the evening. And there's some that will tell you, no, this one is, you know, is okay. Nothing's going to happen, so to speak.
This vaccine is not like the oral polio vaccine and other vaccines. These are injectables. So they come with associated adverse reaction over time. I think that also opens a window for us to do some research. There is no end to research. So I am advocating that we leave it open and actually study what are the pre, what are the post immunization, kind of a research that we can't be able to do to actually manage most of these confounders that may actually happen in the future.
Let's throw it back to Lagos now. I believe they have more questions for the guest in Kano.
Yeah, Dr. Tijani, so perhaps if you heard Dr. Akiala about what plans does the state have for those who may have some sort of vaccine injury? Are you thinking about that?
Yes, certainly. Maybe again to refer back to your first questions. Yes, our governor and other high-profile officials will take the vaccines publicly. We intend to have a state launch where all the stakeholders, especially to improve vaccine acceptability in Kano and also to reduce the hesitancy. The governor, the deputy governor, and the emir of Kano and other emirs in Kano would take the vaccine publicly. So taking one of your questions that I was lost. And again, as per the plan, we also have mounted surveillance for adverse effect following immunization, and which we will follow up in conjunction with NAFDAC so that we observe and see what happens. And we will also put necessary structures to ensure that people who have adverse effect following immunization would be identified and get necessary attention.
Okay. All right. We'll do. Thank you for talking to us this morning. Dr. Tijani Hussaini, Technical Coordinator, COVID-19 Response in Kano.
Thank you.
All right. Well, Dr. Akiala, a good thing you raised that point because, I mean, several people kept giving the impression that they all will react the same way. But we know that these things don't happen like that. People will react differently. And so you never can tell. But let me just get your thoughts on what do you think about the government's decision? Because, I mean, several people talking about it, that if you have not been vaccinated, you cannot travel.
Yeah, I think that's a quite novel policy. This is because when you look at global health, international travels are also dynamics for transmission of infectious diseases. So those are good policies that it is globally inclined, and I think I buy into that policy. It's just that, Chamberlain, we need to actually look at how we can be able to make sure that this policy is being enacted properly. Are you aware that if you are traveling to countries in West Africa and you needed to have yellow fever vaccine, they share yellow fever vaccine cards in the plane. So we don't know whether people actually take the vaccines or not.
But
even the
pardon me
tests,
because about this one, sorry to jump in. You know,
I read in the news last week.
Let me just add this so you can respond equally as well. You know, when you say you buy into this, one wonders the timeline for this vaccination is 2 years, and at the moment, so what about those who perhaps are 18 or just a little over 18, and then they are in the, of course, very lower phases, and they don't get that vaccine, they're not in the front lines, and they'll get it much later, and they require travel. Does that mean that they will not be able to travel because they've not been vaccinated?
So I agree with you, Chamberlain. There are international students that travels for their degree programs abroad that they are less than 18 years. So they need to take the vaccine. And I agree with you that let me also say that we also need to open window for private sector to come in, just like the way we did when we are doing COVID testing. And you discover that private labs have been accredited for that. So in the coming days to come, we expect government to roll out policies where private centers can, be enlisted to be giving out COVID vaccine. Secondly, it is only the Oxford vaccine and the Moderna that people that are above 18 years can take. Other vaccines such as Johnson & Johnson are trying to see how they will wrap up their clinical trials so that people below 18 years and pregnant women can also take the vaccines. So it also opens windows for us to go into research. I'm quite sure that in the coming days and months to come, there will be a kind of a review into the protocol for the vaccine administration so that people at all age group can be able to take the vaccines because studies have been completed and then we have sufficient data to support the policy. So I agree with you that this is going to be a major bottleneck. For example, you have a nursing mother that is supposed to travel with her baby and the baby is even less than a year, or you have someone that got an admission to study maybe for his bachelor degree outside. And then he's 16, 17 years. Are we going to say that this policy is going to stop them from traveling? So we need to also make the policy flexible, and we need to also generate data to also inform the manufacturer of this vaccine so that protocols can be optimized and the strategy can be reviewed.
Okay, because I was just wondering that those who also think that we only receive less than 4 million of this vaccine. What if the traveling population triples that? Does it mean that what? When are we receiving the next batch of the vaccines? So what happens to those who travel by land to neighboring countries? That's international travel. Will it affect them as well? I don't know. I just got a question.
Yeah, but while we're talking about that, yes, Doctor, while we're talking about all of that, I mean, perhaps the concern here is, okay, we're waiting for these vaccines to come from outside. And, you would remember that, from the very beginning of our fight against this war, we've been talking about some forms of local solutions here and there. I'm just wondering, how long does it really have to take? All of the infrastructure that we have locally to produce vaccines and all of that, they seem to be either comatose or just struggling to get back on their feet after so many years. What's the shortfall here? This concern is being raised because we've also heard from various sources that this is not the last pandemic we're going to have. This is not the last outbreak we're going to have. Wouldn't it be good for us to begin to prepare now, just in case this happens again, so we don't wait for a first tranche of vaccines of 4 million for a population of 200 million?
Absolutely. Fantastic recommendation from you out there. And I think that that should be the conversation that we should be having now. I was thinking that by now we would have had a platform. When I think I've been on this station to talk about local content development in terms of vaccine production. And I was expecting that certain platforms would have been set up by now. For example, now that we are vaccinating 4 million, people, I was thinking that in terms of even evaluating the post-vaccination exercise, which is a component of vaccine production, I was expecting that that platform would have been in place. So I agree with you that now would have set certain platforms. I was here last time and I was sharing with Maokwe that we need a presidential welcome home initiative. There are classical Nigerians. One thing that God has blessed Nigerians with is the human resources. People leading vaccine development, not only for COVID, for other vaccines in the world, are Nigerians. So in the coming days to come, we expect, by now we would have a vaccine, a presidential vaccine initiative, even have vaccine ambassadors, people that should key into this. So I agree with you that by now we would have set up platforms for even local content development. My worry is that we have audio policies that are not implemented. We have things that, take ages. Even some of my colleagues applied for research grant with CBN. None of them has even gotten a call, like that. A lot even have applied for TED Fund, for research grant for COVID. None of them, has, So this opens a window for us to actually, come up with multiple research consortium in terms of vaccine development. So I agree with your recommendations. They are quite valid. By now, we would have also had platforms where we should have post-vaccination efficacy research, in terms of looking at the efficacy of the vaccines.
Indeed, I think that we had a conversation with the NAFTA DG, and she was talking about how pharmacovigilance is the next phase now. She's talking about a phase 4 of the vaccine rollout, and she says that she is looking forward to receiving those kinds of reports from amongst Nigerians, and she wants everyone to be on the lookout. However, I do not know what we're not certain of is whether or not those channels for reportage have been, clearly marked out, so that if you have any adverse, reactions from the vaccine, there is a clear map for you to follow to report what it is that you have noticed. Have you heard of any?
Yeah, so I agree with her that pharmacovigilance, in pharmacoepidemiology, those are studies that you do for post-vaccination exercise. I've read the protocol, the national protocol for this exercise. I've not seen a place where there is a follow-up for people that, take the vaccine. I was also thinking that there also should be a platform where people should report adverse. I think by now we should.
So you haven't seen that?
I haven't seen that.
Yeah.
I haven't seen that. We should also have that in these centers, because when I applied online yesterday, I chose the center closer to where I am. And they took me to a primary health care center, which I am in the know. And I also got an email, and I also got a text message that this is my time between 8 to 10. This is when I'm supposed to take the vaccine. I will encourage the National Primary Healthcare Agency, since they have generated this database and they have a pool of numbers and email address. Once people take this vaccine, we should have a barcode that should flag that someone has taken the vaccine. Then a reminder of possible adverse effects and reactions should follow up through a text message. We can also see to how people can return back, even before their second dose, in days, should in case there are these adverse effects and adverse reactions. So that is quite key.
Yes.
So that should also not be saddled in NAFDAC. We should have an independent vaccine, a platform, like an institute or like a center. By now, that we should have the pharmacovigilance. They should work in collaboration with NAFDAC, but independently to see how this can be monitored. Because NAFDAC will be overwhelmed with a lot of feedbacks that they will get.
You said you registered yesterday.
Yes.
Online.
I registered online.
Do you care to share how you went about it?
Yeah, so so you must have a platform that is Android enabled. So I begin to wonder for people that they don't have Androids. I want to also encourage the National Primary Health Care to also see to how we can network with mobile service provider for a quote where I have to do for my mom, but I discovered that she doesn't have an email address. She's about 80 years old, so I have to use my email address or do her number, you know, like that. There are also hard to reach areas where people don't even have access to phones. Android
so those are the downsides. I was hoping that you could quickly tell us, you know, what website you went to.
Yeah, so what I did was that there was a link. I went through the link and I log in, and they asked me for my full names, which I stated, my email address and my phone numbers. Whether I'm a health worker, I said, yes, I'm a health worker. They directed me to my state and local government of residence where I reside, and then I click. Then they asked me the wards, and there are centers in wards, primary health care, secondary health care, and tertiary health care. Which one do I want? So I just look for a nearby that is less than 2 kilometers, and I clicked in. And so I got that.
Well, if you're looking to register, I'm sure you can find the information online, but you can also learn from his experience. We have to thank you so much for coming on Sunrise Early this morning. Dr. Akela Ishaku is a virologist, a public health epidemiologist, and he's been speaking with us in our Abuja studios. Sunrise Early continues in a moment, and we'll have another topic for you. Please stay with us.